DREDF, Healthcare Stories. Jennifer Thomas is being interviewed in an office at Access Living in Chicago, Illinois. Her interview is conducted in two parts. This is part one.
My name is Jennifer Thomas. I'm 35 years old. I live in Arlington Heights with my husband and our two fraternal twins, Abigail and Noah, who are 7. I am the personal assistance coordinator at a Center for Independent Living in the city of Chicago. I am a person born with cerebral palsy, and I was born in the 7th month of pregnancy, so I was about 8 weeks early. My disability obviously is something I've had for all of my life. I guess it can impact my life when people don't ask what I need and assume what I need, or assume they know the best way to treat me, especially in a medical setting. When I was 9 months pregnant and had to go for one of my last ultrasounds, there was no accessible table. Walking into a waiting room and there's couches everywhere. Really can barely get up to the desk to check in, and somebody says, oh, and really sort of dumbfounded, like, how are we going to treat her? And, wow, like a person with a disability getting pregnant was some kind of science experiment. And it's not. They didn't know how to get me on the table, and I didn't have the wherewithal or the balance to transfer, but I had to have the ultrasound, so it often took 3 technicians, because there were no adjustable tables, just to get me on and off the table. And when people are scheduling appointments and they don't consider the amount of time it takes to do a transfer, if an appointment is 20-25 minutes and you need to transfer, and that's already taken out of the 20-25 minutes, then where's the time for the real quality time for the appointment to diagnose the issue or have the test done? Because I have CP, I have a high amount of tone, and so I wouldn't have been able to go through the natural birthing process anyway. So it was automatically assumed that I was going to have a C-section. And so I knew, it was going to be a surgical birth and that there'd be 50 people in the room. And so, but knowing ahead of time, there were no assumptions made. There was an assumption after birth when, as typically happens on a maternity floor, the lactation consultant comes in and visits. And she said to me, I have CP, so I have use of my left hand. My right hand, as I often say, is just for decoration or support. The lactation consultant said to me, well, you have twins, so you got to do this twice. I said, that's fine. She said, can you turn your hand like a football? I said, yeah, on this side I can. This side, not so much. She then said to me, well, then you can't breastfeed. I said, what? She said, you're not going to be able to do it. I said, oh, okay. She continued to argue with me about my ability to turn my hand like a football. So at that point, I had a friend who was an occupational therapist just down the street. I called her and I said, look, I really need to ask you an embarrassing question. Can you come here and help me? She said, oh, you're not going to be shy? I said, no, I'm not, because this medical professional doesn't know what she's doing. I was crying because I wanted to be able to at least attempt to breastfeed my children. So she came over, and then we decided that I could do it, but I needed help. I needed a pump. But not only did I need a pump, I needed someone with the physical capability to use the pump, because it was, you know, positioning and what have you. And that's how I got it done.
The idea that people with disabilities can't or shouldn't get pregnant. Having my kids is the best thing I ever did.
Last December, when I went for my annual OBGYN appointment, I was told to ask for a specific person, schedule my appointment, and tell them I needed a specific room that had an adjustable table and extra time to transfer, because the doctor's appointments were typically 15 minutes. I did all that. The day of the appointment came, day of the appointment went, and then the patient care technician said to me, "You're only booked for a 15-minute appointment. I don't think he can see you today." I was out of my chair, undressed, ready to be seen. I happened to march down the hallway at this particular hospital and say, "I'm not leaving. I came from Arlington Heights. It's my birthday. I don't want to be here. I want my exam." They went and got the doctor's secretary. They said they made a mistake. They're sorry. I said, "I'm not rescheduling." And he saw me and then reminded me again to tell them I needed extra time to transfer, etc. Sometimes I don't make appointments with my regular doctor and I get sick, or I go into an urgent care center because I think I have a cold or a bladder infection. Anybody can test for that. So in particular, there was a time when I went in and I said, "I think I have a bladder infection." And they said, "Okay, well, we need a urine sample." I said, "Fine." I said, "I can't really physically hold the cup, drop the specimen. You're better off to straight cath me." So the nurse went off and told the doctor. The doctor said, "Just give her a hat, have her catch it." I said, "It won't be clean, and I want to know if I'm sick." And then so she came in to talk to me before, the doctor came in to talk to me before I left the specimen. And I said to her, "Just straight cath me." And she said, "Well, I don't want to put you through it, blah, blah, blah." So I gave her the specimen in the hat. Then she said, "It's not clean, it's not going to test well." I said, "I told you that." She said, "But I don't want to put you through all that." I said, "But here I'm identifying my need, telling you how to get what you need to appropriately test me, and you don't want to do it, and you end up doing it anyway." It's more trauma. If I'm willing to be straight cathed because I want to know if I'm sick or not, don't assume that it's a trauma on me if I'm telling you how to diagnose a problem. But then they automatically assume that I don't go to the bathroom naturally. You know, "Well, do you straight cath at home?" No. So it's just assumptions about people and people with disabilities. About my physical medicine and rehab doctor? She's gone. No. You know, it's all about treating the whole person. She doesn't just, "Hi, how are you? Okay, so this is bothering you? Let's throw medicine at you." I come in the room. I usually have to wait for her. She pulls up a chair. She faces me. She looks at me. She says, how are things? Fine. How's DJ, my husband? Fine. How are the kids? Oh, I'm so stressed out. And I remember when they were first born and there were things I couldn't do. I'd say to her, they don't like me. They like their dad. And she'd say, it's a phase, it's okay. And every time, so she'd talk to me about being me and the other things in my life. And then when she makes suggestions, she doesn't just tell me I have to do them. She says, this is what I think. What do you think?
She's the head of the team. I decide. It's person-centered care.
People with disabilities are going to age with disabilities, and they're going to need physicians who don't say, I don't know what to do, I'm dumbfounded. Because the good doctor I see one day might retire. And then what? Healthcare is a human right, with or without a disability. Everybody has the right to make sure that they're healthy. And doctors take a Hippocratic oath. And that's to treat everybody, not the old, not the young, not the only non-disabled people. So treat others as you want to be treated.
Healthcare Stories, made possible with generous support from the Manuel D. and Rhoda Mayerson Foundation. Jennifer Thomas was interviewed at Access Living Chicago, July 2011. For more information, visit the Disability Rights Education and Defense Fund website, dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution Non-Commercial Share Alike 3.0 Unported license.